I would like to ask the Minister for Health and Social Care how he will replace the Children's Services Partnership that was disbanded in December 2017, and whether its demise has had a negative impact on provision of services for children.
Minister to reply, Mr Ashford.
Thank you, Mr President. I would refer the Honourable Member for Garff to the answer given by the Chief Minister and also the answer given by the Minister for Education a few moments ago. I concur completely with the answers that have been given, and the only thing I would add is to emphasise again, Mr President, that this was not a recommendation from Council of Ministers. It was an independent recommendation by the then Chair of the Safeguarding Board, and also was actually agreed by the partnership itself.
Supplementary.
Thank you, Mr President. Thanks to the Minister for that. Can he tell me if there is any outside input into the department, particularly looking at services for children, and given what we've heard in terms of the numbers requiring mental health treatment particularly, would he think that the ability of a very agile body, including outside scrutiny, to come up with solutions and perhaps put in more early assistance, early help and support, and self-help within areas that need it, might be beneficial and stop the escalation of problems that then become an issue for his department?
Minister to reply.
Thank you, Mr President. The Department clearly tries to work with third sector and other organisations wherever and whenever we can. But just in relation to the second half of the question there seems to be a slight rewriting of history, Mr President, in the fact that it seems to be being suggested that the partnership was this agile organisation that was providing this support. And certainly the evidence and certainly the investigations by the independent chair of safeguarding that led to this reform suggested it wasn't. What was happening was work was getting duplicated and there was actually more chance of things falling through the gaps. That was one of the reasons the recommendation came forward for the partnership to end and everything to be combined up with the lead officer group. As the Minister for Education has already stated, where there is the ability for people still to engage within that group, and I know that the current children's champion is engaging with that group as well. So the whole point of doing this was to give a more joined up approach, which I think personally, the more I've looked at this since this question was laid last week, I believe has been. And in fact I would refer the Honourable Member, Mr President, to both the Nolan principles and the British and Irish Ombudsman Association principles, the last of which in the Nolan principles is leadership, and the last of which in the BIOA is effectiveness. And one of the things, the most interesting things that came out of the independent chair of safeguarding's review of the partnership was that he didn't feel the partnership as it was operating met either of those principles.
Honourable Member for Douglas Central, Mrs Corlett.
Thank you, Mr President. Would the Minister agree with me that committees must have a clear function? Children's Services Partnership had 17 members, mostly directors and officers, and to have all those people in one place at one time is an expensive use of their time if there is no clear direction. And would he agree with me that this committee was struggling to find direction?
Hear, hear. Minister to reply.
Thank you, Mr President. I most certainly do concur with the Honourable Member for Douglas Central, Mrs Corlett. And in fact, actually, again, one of the interesting things that came out of the review was there was a feeling that once the strategy had been put in place, the partnership lacked direction, that it wasn't actually achieving anything. And certainly in this area, one of the things that we need to be very clear on is there needs to be objectives and there needs to be things to achieve. And that was one of the reasons that the functions were moved into the combined action plan to give a much more robust lead on what was being achieved and how it was going to be achieved.